And be sure to invite, we'll give more time for people to come in. Invite your friends, invite your colleagues, invite other students who would benefit from. And be sure to invite, we'll give more time. Let's see, let me share my screen. Can everyone see my video on YouTube?
Yes, we can see it.
Awesome.
Yes, ma'am.
Thank you. Awesome. Awesome. So I'm just waiting for some other individuals to join, those who joined other conversations. So for those of you who do not know me, my name is Dr. Eseosa.ighodaro. I'm a neurologist, second year. I am a neuroscientist, PhD trained. I'm also a health advocate. So I do a lot of things, but one thing that I love to do on social media is create a lot of virtual teaching for students. And I like to focus on clinical reasoning because you guys get a lot of information, a lot of know-how when it comes to facts, when it comes to mechanisms and pathophysiology. So I want to help you guys take that information that you know and apply it to a clinical situation because that is the bread and butter of medicine. And oh, it's so cool. I'm also seeing people ask me questions on the YouTube stream. So that's great. And I'm also seeing people here asking questions as well. So this is going to be phenomenal, integrating both YouTube with Clubhouse. We're going to see how this goes. So this is phenomenal. So make sure you ping your friends, you ping your colleagues, you ping everyone and anyone who would benefit from this free knowledge and this free information. Because, you know, you're getting advice from an expert on how to approach a clinical scenario. So with that, we can wait a couple of minutes and then we will get started. Does anyone have any questions?
I don't think so.
Awesome. Looks like there's someone on YouTube that has a question. How do we join to speak? Okay, let me text them. Let's have another person come on stage. Does anyone else want to come on stage and help work through this clinical scenario? Oh, okay. I'm in Clubhouse right now. Oh, someone has to open up the room.
Hi, Dr. Eseosa.
Hi.
Great that went. Let's see if we can open the room too.
Awesome.
So let visitors in. I'm pretty sure you can do it. I was in another room. Somebody just open about questions of pre-med. And if you click the three dots next to the lock, it will show let users in. If you would like to try, or I could do it.
Yeah, you can do it because for me it says I can let visitors in, but it removes the club name.
Oh, for me it said let visitors in the room, and then you get it right. Yep.
Yeah.
Then, okay. It's strange. Sometimes, guys, there's an update on the Apple Store too, just for everybody's info, and And yeah, I might be in and out because I'm in the middle of something, but I will be trying to, participate. I'll be listening on the background.
Cool. Thanks.
But I encourage everyone to be here and to really give it a shot. I know Ernest is getting ready for his step 2, and all the best to you. And yeah, guys, just engage. I'll pin some people here. So see you guys.
Thank you. Thank you so much. Okay, everyone, we're going to get started. So how this is going to work is you guys see the chief complaint, and I will change into character and I will be that patient, and you all will be one mind, and you guys will be first year interns, and you will figure out what's going on with this patient. You go from chief complaint all the way down to the assessment and plan. And then after 30 minutes is over, you guys will then present the case to the attending. Then I'll switch from the patient to the attending. You'll present the case to me, and then we will talk about your strategies, and then I'll reveal the diagnosis and then give you guys some teaching points. How does that sound for everybody? Awesome. It's going to be fun. So let's get started. And along with this, make sure you sign up for my workshops, because not only am I going to be doing this in Clubhouse with a YouTube component, I also will be starting to do this in Zoom rooms, and it'll be fun, interactive, and we can get more, it'll be longer, and we'll get more information from those Zoom workshops. And the favorite thing is that they are free. They're FREE, free. You can't beat free, right, y'all? You can't beat free. So be sure to, you can sign up by messaging me on my social media. You can email me. You can find me on Twitter, Facebook, Instagram, message me, and then I'll send you the form to fill out. And all you got to do is just watch a couple of YouTube videos and invite a couple of friends, and boom, you're signed up for free. You ain't got to pay nothing, not even $1, free. So be sure to send me an email, reach out, and I'll get you all signed up. So without further ado, let's get started. Y'all ready? Yes. Okay, cool. So let me get into character. Okay, I am ready. So the environment is, you are in the doctor's office, outpatient setting, in the general neurology office. And this patient is in the office waiting, and the attendant says, please go see this patient. And then when you're done, let me know. Action.
So we can just start, we can walk up to the patient now, right? Just to make sure.
Yeah. And then it's going to be a group effort. So I would invite you guys to leave your mics off and, talk it out. You got 30 minutes. The time starts now.
Hi, I'm Nishita Staff. And what is your name? Do you have an appointment with us today?
Yes, I do. I'm so excited to be here because I having a lot of trouble sleeping. My name is Miss Jackson, but you can call me Sally.
Oh, hi, Sally. It's nice to meet you. Well, actually, let me take you back in the room here so we can kind of figure out what's going on, okay?
Thank you.
Going back to the room. All right, so, wait, I'm the doctor, or are we the nurses?
You the doctor, you the intern.
Okay.
You got that title now.
All right, so tell me what's going on with you today, Sally.
Well, first of all, who are you?
Oh, I'm sorry. My name, I guess I probably wasn't clear earlier. So I'm Nishita Sapp. I'm one of the interns here. I work with Dr. Eseosa. So
Okay.
I'll be helping you today. Is your name right? I'm so sorry.
It's okay. Yeah. Okay, cool. Okay, cool. Well, let's do this.
So you say you're having problems sleeping?
Yeah, I am. It's just been hard.
And is it just like sleeping through the night, or are you waking up at night, or is it having problems falling asleep? What kind of problems are you having when it comes to sleep?
I'm not able to go to sleep.
Oh, okay. Are you experiencing any pain anywhere?
No.
No pain? Okay. And how long has this been going
on? For about a couple of months now.
Couple of months, okay. And was it gradual or just kind of all of a sudden you just weren't able to sleep for the last few months?
Kind of all of a sudden, it feels like.
Okay. And let's see here. Are you on any types of prescription medications?
Nope, not really.
Medications, okay. And are you working full-time, part-time? Are you a student?
Yeah, I'm a student.
You're a student? Do you go to school full-time or part-time?
Full-time.
Full-time. All right. And what's your normal sleep schedule like? So before you were having problems sleeping, around what time did you go to bed every night?
I used to I go to bed maybe 10 p.m.
10 p.m. Okay. And do you ever get any headaches? Are you having problems with your vision or anything like that?
Nope, no headaches.
No headaches. Vision.
And the other two, you guys are welcome to chime in as well. And if you're watching on my YouTube channel, you'll see as you guys are asking questions, you'll see the answers on the YouTube channel, and you also will see the timer.
Oh, nice.
Yeah.
Did you guys want to chime in? Okay. And so tell me some other problems you might be experiencing. Is it just your sleep, or have you noticed anything else different?
Well, it's just, I just started college, and, this is my first time away from my family. So it's just been a very hard transition for me.
How long have you been in college?
For a few months now. It's this, the fall semester just started.
Are you stressed out in school? Is it a lot doing a lot in school, or?
Yeah, it's not the same. It's not the same as high school. And I'm just, I'm in the dorm room. And I'm having roommate. I really don't like my roommate. She's very messy. And, it's hard for me to because it's hard for me to wake up for my classes sometimes because I don't get enough sleep. So then I miss my alarm. Then I'm late to my classes. Sometimes I miss my classes. So I'm falling behind, and I don't know.
Sounds like you're pretty exhausted too.
Yeah. So
when you do fall asleep at night, how often would you say on average do you wake up in the middle of the night?
I'm able to fall I don't wake up in the middle of the night. It's just I just can't go to sleep. When I do eventually fall asleep, I sleep for maybe 2 or 3 hours, and then I got to get up because of the alarm.
And has anything changed with your social, getting out and hanging out with people, or your social interactions? Has anything changed with that? I know you're pretty busy with school and everything, so I'm assuming maybe that can take away some of your time, but you tell me, has there been any changes there that you've noticed?
No, when I can, I still try and hang out with my friends and, go to parties and stuff when I'm not trying to go to sleep.
Okay. All right. Well, let me go enter these notes real quick. I'm going to leave the room for just a second, and I will be right back.
Okay.
I think one of my associates is going to come in and check on you.
Cool. Anyone else in the state? Or you guys chime in. You know, this is a team effort.
Oh, I wonder if Ernest is having problems with his
audio. Yeah, because I see him trying to ask a question or say something. What about the other?
Hi.
Hi, we hear you.
Okay. Hi, Jackson. How you doing? My name is Ernest, Dr. Ernest.
Hi, Dr. Ernest.
I and Dr. Nashida will be taking care of you.
Thanks.
Yeah, I understand she has asked a couple of questions. How are you feeling today?
I'm feeling fine. Kind of tired. I just want to be able to go to sleep.
Is there any other thing so relevant you want to tell us today?
Well, I just want to know why I can't fall asleep.
Okay.
And it's really
you spend a lot of time on your bed.
Yeah. Like when I try to go to bed around 10, and then I'm not able to. Like I'll be in bed for, a couple hours, 1 o'clock, 2 o'clock, still not able to go to sleep. And maybe I may fall asleep, randomly.
Oh, okay. So sorry.
And then I only get like 2 or 3 hours of sleep before I have to get up. So I just wish that I could just go to sleep early. I just wish I could just fall asleep. I'm having difficulties falling asleep.
Can you just give me like a rough picture of what your day goes like?
What, my day?
What time you get back to your room? How much time you spend in your bed before it's your bedtime? And if you just if you routinely sleep off, or this is something has really changed.
Yeah. So after I come home from classes, then I'll eat dinner. I come home, I'll probably finish classes around 5 p.m. and then I return home, then I eat dinner, and then I study, and then I also do my homework. And then after that, around 10 o'clock is when I try and go to bed.
Okay. And you told Dr. Nashida you had no problems with your sight?
Nope.
No headaches?
Nope.
Do you feel sleepy during the day?
Yes, I do. I feel very sleepy. Like sometimes I fall asleep in class.
Oh wow. You think it's affecting your performance?
Definitely. Definitely.
Sorry.
That's okay. And I feel like my parents are gonna withdraw me out of school. They say that if I can't, keep up my grades, if I can't figure it out, that they're not gonna pay for school anymore. And then I'm gonna have to leave.
Imagine.
Are you struggling in your classes, Sally?
Yes.
Do you think it's mostly because of sleep, or do you feel like you just have so much? I remember you mentioned earlier you have a lot going on. Do you feel like it's a lot you're juggling right now with school just starting, with COVID going on? Do you just kind of feel like you're stressed out from everything going on?
Yeah, I'm stressed out, but I just feel like if I was able to go to sleep, a lot of the, issues that I want to be falling asleep in class. I wouldn't miss my classes, and I wouldn't feel tired, and I would, be able to get my work done. So yeah, I think it's just normal stress, but I think the me not being able to sleep is really affecting it, making things worse.
will it be okay if I'll just ask, do you feel like anything besides school could be the problem?
Say that again?
You think it could be any other thing besides school?
No.
That keeps you awake?
No, not really. Because I didn't have this before. Like before I started school, everything was fine.
All right, so when you're awake, what do you do? Like between 10 p.m. and when you eventually fall asleep, what do you do? Or what do you find yourself doing?
Oh, when I can't fall asleep?
Yeah, when you can't fall asleep.
Well, I'll watch TV. I'll, get on the computer, or get on my phone, or, look at social media and stuff to see if that can, make me tired.
Have you tried falling asleep without any of this, putting off the lights, putting off your computer, turning off the TV, putting away your phone?
No, I haven't tried that. So maybe I should. I haven't tried that.
Because most times that could be the problem.
Oh, okay.
Being addicted to your phones, always wanting to see what's trending.
I see.
Getting unusual texts or alerts or call could be a problem. Could disrupt your cycle. I
see.
Yeah. Do you have like a routine, like an evening routine? Or it's just anyhow the night goes, you end up to sleep? Or do you have like what you do?
Do I have
that makes your day complete?
What was the question?
Do you have like a routine?
A routine? Like
evening routine?
I go to classes and then I come home, eat dinner, study, do homework, and then I go to sleep.
Okay. All right.
Do you work out? Oh, sorry. What about coffee? Do you drink any kind of drinks before sleep?
Yes, I love Red Bull. Because I need to study. And if I don't study, then I'm going to fail even further behind in classes. But because I'm so sleepy throughout the day, I have to drink Red Bull so that I could, stay up and do my homework.
You think you're taking a lot of Red Bull?
Mm-hmm.
I think it's a lot.
I just drink 1 or 2 cans a day.
Well, I guess the Red Bull is new. Sorry. The Red Bull is new to your routine. Did you used to take a lot of Red Bull before now?
No, I just started it in college.
Just trying to ask a question.
Around what time do you drink the Red Bulls?
Maybe like around 6 or 7.
Do you take any drugs or drinks?
Nope. I stay away from that stuff.
Mm-hmm. And is there anything that you think it might be just based on how you've been feeling over time? Or are you just trying to kind of figuring out, is there anything else that you think it might be?
Oh, I don't know. I have no idea. I'm just trying to, I'm just trying to figure out how to sleep better.
Okay. I don't know. Do you feel, I think the Red Bull ought to keep you alert. So I would advise you to take it at night. Could you adjust that?
Yeah, if that's what you think I need to do, sure.
Try.
Okay, that's what you think.
Yeah, but I believe it's caffeinated. that should keep you away from sleeping. So that may be a problem also.
Okay. You guys have 15 minutes.
Okay.
Do you have problems with memory?
No, not really.
Mm-hmm.
Have you had this kind of incidents in the past?
Nope.
This is the first time you're having issues sleeping?
Yeah.
Have you had any medical conditions in the past that you want to tell us about?
Nope.
Have you had any surgeries in the past?
Nope.
Do you exercise?
I probably run a mile a day.
Okay. And what about, how is your nutrition? Like, what do you eat before sleep?
Cafeteria food.
Sounds like you're pretty healthy.
Thanks.
Do you have, how many days a week do you notice that you have this problem? Is it more than 3 days a week, you say?
Oh, every day.
Okay. And do you have any, do you know of any history of your family maybe having problems with sleep, like maybe insomnia or anything like that?
No.
Okay. You take alcohol?
Nope. I stay away from that stuff.
You don't use drugs?
Nope.
And you're not on any routine medication?
Nope.
No, baby. Now, I'll have to talk to Dr. Nashida and Dr. Dane. If I got to me, right?
Yes,
Just give us a second.
Okay, thanks.
You're welcome.
We'll be right back.
Okay.
So, let's see. So we have about 12 minutes. What are you thinking, Dr. Miss and Dr. Danette? So I was wondering if we should, what were you thinking we should do?
I feel like probably if this is her first time, I will just do baseline investigations. But generally, I think she would benefit from just reassurance and readjust some of her habits. I don't know. I'm not okay with the caffeinated drinks she takes in the evening. Okay. That could be a cause of distorted sleep. Mm-hmm. It's okay. Everyone has to deal with the pressure of college. A lot of things change. Yeah, but and then you also need the drink to boost your performance to meet up.
Right.
Yeah, but I think if you can work around that, she'll probably sleep better.
Does we try to maybe suggest a schedule for her to try to stick to? And like you said earlier about the caffeinated drinks, to not take those drinks like maybe past a certain time, like possibly just use them in the morning if she feels the need to use the Red Bull. Maybe try drinking it in the morning, but really probably a good idea that she just try to steer clear of it. She's already running a mile a day, so she's getting the workouts in. And I didn't see anything that urgent, like she's not having any headaches, no vision problems. So right away, I don't see that she's having anything that requires immediate emergency medical attention. So far, I think we're all like thinking along the same treatment plan.
Yeah, I would also want her to probably talk to someone, maybe her advisor or her mentor, someone that could help her deal with the pressure of college and stuff. Because it's actually a lot. Yeah. So maybe pushing her to go the extra mile just for performance sake. Someone that actually understands.
Yeah, and try to avoid using phone like 2 hours before sleep, and maybe like try taking a hot bath or something, and also maybe meditation to be more calm. And since you've had a stressful day with all the studies, and try to take meditation music and try, to calm.
Are you talking to me?
Yeah, maybe you should also try to. Oh.
Oh, I thought we stepped out. Sorry.
Okay, never mind. Sorry, I thought I didn't know. Okay, never mind. No, sorry.
We'll be back in a second.
Okay.
Real soon.
Yeah, probably also tell her something about I don't know.
Okay.
Therapy.
I think that's a good
like make her bed a little bit sacred. I think it works sometimes. Just make your bed when you step out in the morning, and then you only stay on your bed if you're ready to sleep. And when you're ready to sleep, you take out every form of distraction.
Mm-hmm.
I think you should improve the sleep. Like when it's time to sleep, you're going to an already made bed, and you don't have your phones, no lights, no any phone, no other form of distraction.
Mm-hmm. I agree.
Yeah, I think all of this should help her. And I will probably see her in a month's time. If she gets better, she will come back if there's any other complaint.
Mm-hmm. But no medication or anything, right?
Yeah, I don't think she needs any medication. No.
Mm-hmm. Yeah, I agree.
Okay, kept our patient waiting. Let's go see her.
Mm-hmm.
Hi, Sally.
Hi.
Yeah, we're back.
Oh, great. So, what's wrong with me?
Okay. Nina, do you want to go first?
Okay. So first, that coffee before sleep, I don't think it's going to help a lot with your sleeping. So I would advise you to try to cut the caffeine like at least 3-4 hours before bed. And also try to be more calm before sleeping, and maybe some meditation or reading something until you feel sleepy. Yeah, that's what I would say. Go ahead, Dr. Ernest.
Dr. Ernest, do you have a thing for me?
Yeah, in addition to the caffeine drink that we think you should stop, we also advise the sleep therapy. I think it's every morning you step on, you make your bed, and then try to idolize your bed. You only get on your bed when you're about to sleep. At that time, you should have form of distraction. Just when you're on your bed and also want to probably create a schedule so you don't have to need extra drinks or energy drink, the Red Bull to lift up when you think you're behind. We also think it would be good for you to talk to someone don't understands the pressure of say a new student. That could also help you reduce the pressure. So you don't keep feeling stressed about new steps.
Okay. Wow, this sounds like great advice. Thanks.
Oh yeah, I'm so glad. And also be sure to really try to stick to this sleep schedule.
Okay.
We have what's called a biological clock. And so we're trying to reset that biological clock also. So that way your body will get used to falling asleep at a certain time and getting used to the routines and things like that.
I see. Okay. That sounds good.
Give her the handout with the information and all of our suggestions. I'm sorry, I had to step out in emergency real quick. Did we hand her the information?
Yeah. Oh, thank you for this information. This is great. I appreciate it. You guys
You're welcome.
I appreciate the thoroughness and the teaching, and thank you. I am optimistic that these recommendations will help me fall asleep better.
I really hope so. So I would say, here's our contact information. You can reach us here directly. So if you're having any problems, I want to schedule you for a 2-week follow-up. And so that way you can come back and see us, or we can schedule on the phone. It might be easier with, since you're so busy, if you don't mind, you're more than welcome to just schedule a call with us. You can get on Zoom, or you can come in. That's fine with us too. So, I'm going to go ahead and schedule you for a 2-week follow-up. And if you have any problems or you notice any differences, or maybe after a week, if things just aren't getting close to better, just give us a call and we'll see what we can do from there.
Awesome. Sounds great. Thank you so much.
You're welcome, Sally.
Thanks. You guys thank you so much. I feel good with the recommendation. So I'm going to follow these things. I have the handout, and then I will schedule an appointment to see you all in 2 weeks to see how I'm doing.
Awesome. Sounds like a plan, Sally.
Thank you. Thank you. Thank you so much, doctors.
You're welcome.
Bye.
Have a great day. See you next time.
Bye. Awesome. Now we're going to stop the timer, and I'm just going to, there we go. So now we're going to talk through this. Can everyone see the screen?
Yes, I can see it.
Awesome. Great. So I'm the attendee now. Okay. Great job. Interns. So present. What do you got? Tell me what you got.
Dr. Jeanette, did you want to present or are you available? Just go ahead. Oh, okay. All right. So, hi, Dr. How do you pronounce it? I don't want to say your name wrong.
That's okay. Yes, Dr. Ighodaro. And feel free to read off the Zoom or the YouTube notes.
Oh, thank you.
Yeah.
So we have Miss Sally Jackson here today, and she's come to us. She's having problems falling asleep. It's been going on for the past few months now. She's just started school. She's dealing a lot with college, and just the pressure with trying to keep up her grades.
Is that me?
It just kind of started all of a sudden, and so it's basically around the time that she started school. Oops. There you go. So she says, so her schedule's, for the most part pretty regular, but it's just her sleep that's really throwing her off. She drinks Red Bull like maybe 2-3 hours before bed to kind of help her with studying, but she's having difficulty falling asleep. But then at the same time, she is falling asleep during the day. So we're thinking it's probably the caffeine that's keeping her up at night. And so we suggested that she not take the Red Bulls that she's been drinking to kind of stay up so that she can study. So we suggested that she not drink the Red Bulls before bed, maybe try to drink them in the morning, or just eliminate them altogether. We put her on a schedule, so hopefully that'll kind of get her back into the rhythm of things, getting her something consistent. We gave her suggestions on maybe some other things that could help her fall asleep. So some meditation practices, maybe a warm bath. So, just different things that kind of help her fall asleep. Maybe suggested a schedule. And she's going to follow up with us in 2 weeks to kind of let us know how she's doing. She hasn't had any other problems. There's no family history of anything pertaining to sleep problems that she's aware of, such as, and she, no history of insomnia. She's not taking any prescribed medications. She doesn't drink any alcohol. Her social life is pretty much the same. She exercises. She runs. She goes for a run at least once a day. I forgot. She's having trouble sleeping every night. So it's not just an occasional thing. So it's every night she's having problems sleeping. So that's about all that's going on here. So we're just going to see her here in about 2 weeks. Told her to give us a call if she has any problems before then. But we don't see anything that requires immediate attention, nor does she need to have any labs drawn at this time.
Great. Awesome. Thank you for that story. So now, before I give my feedback, I want you guys to tell me what you did right and things that you think you guys can work on.
I think we did good with the with the story, like asking questions.
Mm-hmm. Is that all you guys did? Are y'all shy? Y'all can boast about yourself. Y'all did a lot of great things, right?
Let's see. I'm hoping we followed the PHIs, but tried. Let's see. What else did we do good? It sounds like the patient was comfortable.
Yeah. Yep. Very good.
That was good. And it also seems like she's happy with our decision for today, and she's ready to give it a try and hope that it works.
Mm-hmm.
Might have asked just a little too many questions, but I think we asked a lot of good questions.
Mm-hmm.
Yeah.
Good. Okay, so what are some things you guys think you can work on?
Maybe do some clinical tests, but we're not able to do that.
Okay.
Should we have taken her? Oh, we probably should have taken her vitals. That was my fault.
Good pickup. Yes, good pickup. Or, you can ask for them and I would have given them to you. Yeah. What else?
Okay. Can't think of anything. I didn't see anything that required us to take labs.
Okay. What else do you present after you present vitals? What is something that you present commonly when you're presenting on rounds? So after you talk about the history, you talk about the vitals. What's next?
Any underlying diseases?
Okay, let's say you're done. Let's say you're done with the subjective, and now you're presenting objective information. You've given me the vitals. What are some other objective information?
I don't know. We didn't examine.
Yeah. Why didn't no one examine me?
Oops, I'm sorry, I missed that. What did we miss?
Physical examination.
Oh, physical exam. Okay. Oh, just to kind of look over her and see if we see anything out of the norm.
Exactly. Yep. You always examine the patient. She's having sleep difficulties. Maybe, I don't know, maybe she has a bruise.
Red eye.
Yeah, red eye. Maybe she has a bruise on her head and, you know, she hit herself and that's causing her to, you know, not be able to sleep, because when she sleeps on it, it's painful. Even though she says it's not painful, maybe she forgot. Or maybe if you know, talk to her, or I'm trying to think what else could cause sleeping difficulties. I don't know. It's for this one, making the case for a physical exam is, you know, actually, no, someone who's having sleeping issues. So many people who have sleeping issues could be due to sleep apnea, right? So you really would be paying attention to her mouth, her throat. You would look and see if you can see her uvula, like things like that. You want to look for structural reasons why she could be having troubles sleeping, because you guys think it's one thing, but you want to make sure it's not other things. And you always do a physical exam head to toe. Okay, great. So let's start from the beginning. So for me, one thing I love doing these rooms because I want to teach students a system. When you're practicing medicine, you always want to develop a system for your approach so that you're efficient, you're effective, and you don't forget things. And what I've noticed many times is that medical students do not have a system down yet. And so, you know, you guys did great asking questions, but you didn't ask all the questions. And sometimes, you know, you get caught up in like, you know, this question and you forget to ask certain questions. So that I tell students, have your system and do that system every single time, and you will not forget key information from the HPI. And when you guys have downtime, I actually did a video that goes through how to take a patient history, and it goes through different parts, like the art of taking a patient history, because I realized that students are, you know, they have some difficulties in doing it in a very systematic way. So I love, so you have the chief complaint. So that's, so how I'm just going to write here parts of the parts of the objective, parts of the subjective. Subjective section. And this is what you'll be presenting on rounds, especially you do this as a medical student and as an intern, and then as you get sophisticated in your craft, you know, you can make things shorter, combine things, but I teach students the full, complete subjective section first. So you guys have the chief complaint, which you got, good. And then you do the history of present, what happened? Hold on. Let me just move this. Okay. Then you all do the HPI, which you guys did a phenomenal job with the HPI. I was really impressed. Good with that, especially for trouble sleeping. And then you get into, you know, some of the review systems that are pertinent. I think you guys could have been more thorough with the review of systems, especially at this stage. So, you know, it's general, then head, ear, nose, throat, you know, any weight loss or weight gain, any watery eyes, itchy eyes, red eyes, runny nose, because sometimes nasal congestion can cause people to have difficulty sleeping, and someone that has nasal congestion, you know, could be a sign of sleep apnea, which could cause someone to have trouble sleeping. Did you have any shortness of breath, any breathing problems? Then you do, so I like to do general, HEENT, then cardiovascular, respiratory, GI, MSK, psych, hematology, and that's it. So make sure you go through your review systems and you have your questions down pat so that you know what you're going to ask for each review system. So that's something you guys did a good review systems for neuro, but you didn't do the review systems for the other parts. Does that make sense?
Yes, definitely.
Okay, great. So then after review systems, this is my order, and you can come up with your own order, but this is the order that makes sense for me. Then you do past medical history, which you guys asked. So great job there. Then I do meds, which you guys also ask. So good job. And then everyone forgets this, and it's extremely important because this can cause someone to go into anaphylactic shock. Allergies. You guys didn't ask me what allergies. So if you wanted to give me a medication and I had an allergy to it, you guys would be sending me to the emergency room for anaphylactic shock. So allergies. And that's why it's so key to have your system and have it down and memorize it and ask your questions in this order so that you don't miss anything. So allergies. Next, I do surgical history, which you guys, did you guys ask me about surgical history? Yeah, you did. Okay, good job. And then after surgical history, then I ask about social history, which you guys did right off the bat. So good job there. And then after social history, I ask family history, which you guys did great with. And then I'm done. So I didn't miss any of the big components of the subjective because it's all right here. And I do this every single time with every single patient. So this is what you keep in mind. I want to make sure I'm not forgetting anything. Meds, allergies, surgical, social, family. Yeah, I do this every single time, every single patient, and I won't miss anything. So that's what I would keep in mind. Now, after I'm done with the subjective, now we go to the objective piece. Let me see. I'll just move this over here. Okay, so now we go to the objective piece. And part of the objective is vitals, which you guys remembered after you were done presenting, and then the physical exam, which you guys missed. And maybe, because we're doing this virtually, so maybe you guys, didn't, wasn't thinking it, or maybe I didn't explain it well. So what I've done in the past is you can just ask me for the vitals and I'll write it down. And then you can just ask me for the physical exam, like parts that you want. I want how do her lymph nodes feel? How does her neck look? How is, what's her heart sounds? What's her breathing sounds? Is her stomach in pain? You can ask me questions to get at the physical exam. So, yeah. So that's part of the objective. And then you can also, if you want labs or imaging, sometimes when a patient is in the office, you can look at their previous labs. You can look at their previous imaging if it's warranted in this person. And then after that, you get to the assessment, and then you get to the plan. So one thing that I noticed is that you guys never told her what her diagnosis was. So in the assessment, that's when you bring everything together and you say, okay, this is what I think's going on. In your assessment, that's your differential diagnosis. So when you guys were presenting, you guys also didn't you didn't tell the attending what the differential diagnosis was. Like and I'll go back and tell you some of the parts you guys did well, but I want you guys to do things in a very systematic order. And I'm telling you, it makes all the difference. And I've seen students that come through, day one, that they're on a rotation, they present like you guys. So you guys, this isn't, this is how every medical student does. This is what I did when I was younger, because I didn't know. But then after I teach them and I break it down, I spend some time with them, their presentations are beautiful. They're organized, so much so that the attendings are like, wow, I've seen that you have definitely come a long way. And also the attendings applaud me and say, hey, I know that you spent a lot of time with these students teaching them the skills. So thank you for that, because I see a difference in their presentation. And it's all because I had residents sit me down and say, this is how you present. And you do this every single time. So you do this every single time, your presentation will always be organized. So assessment and plan. So what you do in the assessment and plan, so you give the differential diagnosis, what's most likely, what's least likely. So in her case, what's most likely, and you guys had it, you just never said it. Insomnia, right? And Yes, she definitely has insomnia secondary to stress because of a new environment in her college setting. So, with the assessment, you give the one-liner, 25-year-old female with an unremarkable past medical history who presents for trouble sleeping. That's your one-liner. And then you say, based upon her history, the most likely diagnosis is insomnia, and here's why. Other things we thought about were sleep apnea. Here's why it's not sleep apnea, So that's how you talk about the assessment. And then the plan, which you guys did a phenomenal job with, which is what you all talked about here. And I don't have any there was no weaknesses in your plan, because your plan honestly was beyond your training level. Because you guys are all med students, right?
Not yet.
Oh, wow, you guys not even all med students. So, I'm impressed. I'm impressed that you guys came up with a very thorough intern level type plan. So that's great. And I feel that students jump to the plan, but they miss some of the basic foundations. So this is what I wanted to teach you guys. And we can, I can do a presentation on like actual sleep and insomnia later. But when I first start out with new students, I really want you guys to practice the presentation and doing it in a systematic manner. And the only way to learn is to practice. And so now next time when you guys go take a patient history, you're not going to forget the allergies. You're not going to forget the vitals or the physical exam, and you won't forget your differential diagnosis. So that is my teaching. You guys did a phenomenal job. And I just, I thank you for, coming up on stage and for volunteering and, for being brave to, work through the case with me, and also being open to, learning and improving your skills. So I applaud you all, and this was fun. Do you guys have any questions?
No, not really, but thank you so much, Dr. Eseosa. It was really helpful, and I learned a lot. Thank you.
Of course.
Thank you. I second that. This is very enjoyable. Thank you so much. I learned a lot as well, Dr. Eseosa.
Of course. Yeah, it's fun for me, and it helps me solidify, the knowledge that I learned. That's how I pick, cases. It's all made up, obviously, but, things that I'm learning, I'll teach a case on it. Ernest, were you going to say something, Ernest?
Yeah. I think traditionally I would have been a little bit more thorough.
Mm-hmm.
But I was, how would I describe it? I was a little bit lax.
Well, next time, now for next time.
I'm a medical doctor, right?
Oh, you're a medical doctor.
Yeah.
I didn't know that.
And then it's a little bit more strict. So.
You could have helped teach me then. You could have helped me teach them.
Because I'm not so sure of what exactly how it's practiced here. So I was just trying to observe. I would have gone deeper if I knew you were expecting so much more.
Oh, you could have helped me teach the medical students and the pre-med students then. Now I know. Awesome. Now I know. Yeah. Next, because what I like to do is any doctors that come into the room, I pull them in to help me teach them. So next time, just let me know. Now that I know, for next time, you'll if you're interested and you're free, you can help me teach them the art of taking a patient history.
Okay.
Cool. Great. Well, I hope you guys follow me. Please please email me or DM me so that I could send you the sign up for the Zoom workshops. And I'll be doing some of these as well on Clubhouse. So be sure to follow that. And my Zoom workshops are going to be a lot more interactive and a lot more teaching. So, be sure to sign up for those. And they are FREE, what? Free. So be sure to sign up.
Looking forward. Thank you.
Great.
I'm going to email you right now.
Fantastic. And I will send you, I'll send you the form, and I look forward to us being in more rooms and workshops together.
Thank you.
Great.
Thank you.
Everyone have a great night.
You too. Have a great night, everyone. Thanks, Dr.
Thank you.
Nice. Bye. Sorry, I'm Dr. Eseosa.
Oh, hold on 1 second. Let me stop the. Give me 1